Hey, are you a business owner, entrepreneur, or professional? If so, we want you to apply to be a featured guest on our show. My name is Adam Torres, and I host the Mission Matters series of podcasts. I've recorded over 3,000 episodes, and we are just getting started. How do you know if you'd be a good guest to be on the show? Well, only one way to find out, and that's to apply, but I'm going to let you in on a little secret. We want guests that have a story to tell, guests with a brand, a product, or a service that can benefit my audience of listeners. If this sounds like you, go to missionmatters.com and click on Be Our Guest to apply. I'd love to talk to you and get to know more about your story. Again, head on over to missionmatters.com and click on Be Our Guest to apply. All right, now let's get into the show.
Hey, I'd like to welcome you to another episode of Mission Matters, your source for all things business. My name is Adam Torres. If you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to apply. All right, so today I have Summer Napier on the line, and she is CEO and president over at Healing Hands Healthcare and Little Black Bag House Calls. Summer, welcome to the show.
Thanks for having me.
All right, Summer. So excited to get into today's topic. So we'll talk about Healing Hands Healthcare and also what caused and inspired you to launch Little Black Bag House Calls. But before we get into that, a lot of entrepreneurs listening, a lot of business owners listening, and let's go and take a couple steps back and just tell us a little bit more about really how you got started on this entrepreneurial journey.
Great. Well, it was a fun one. So I have worked in healthcare for 12 years, and 12 of those years have been in the home health industry. I was working for a big, large healthcare corporation, and I really saw an opportunity to do healthcare better than what it was being done. I felt like my calling, like my mission and my desire to operate healthcare as a healthcare ministry didn't really fit the corporate environment. And so I wanted to live a bigger life. I wanted to be able to make a difference in a bigger way or a more meaningful way. I know a lot of people think, okay, well, corporations have a lot of money, they have a lot of resources, and that's very true. And they do a lot of great work. I just knew that my mission was much different. And so I had the opportunity. I was very blessed to have some really great people around me that, latched onto that mission. And my business partner is also my very best friend. And so we were able just to, dig in and see if this was for us. And we took the leap of faith, and here we are today.
Wow, what an amazing story. And the way I see it is, as you mentioned, a lot of people have that feel or that calling where maybe they don't want to go the corporate route, or they don't want to stay that route, and they have another vision. And not saying it's bad, by the way, nothing wrong with corporate. It's just saying it's just not for them. So not judging, but, there's a difference between having that idea and then like actually going out and executing on it. So, let's talk for a moment or two to those that have that idea, but maybe haven't quite taken that leap yet. Like, what kind of advice would you give to them, having done it yourself?
Oh man. I would say that most entrepreneurs, the ones that I've talked to, and I know that I personally had this, you start feeling that pull years before you're probably ready to take that leap of faith. Somebody who's strong in my faith, and we run our businesses based on, our deeply rooted faith. There were years where I struggled internally with, can I do it? Am I capable? I was young. I was 28, I think, when I started Healing Hands Healthcare. And so you're going to know the pull. You're going to know when things don't sit right, when you're sitting in a meeting at work and you don't like the way that sounded, you don't like the decisions that are being made. And, you have the opportunity at that moment to decide if you're going to conform or if you're going to do life in a bigger way. And for several years, I just had that pull. And I knew that, my creator was calling me to do something different. One of the things about entrepreneurs is when you start your first business, it's really scary. And so a lot of times you need people around you that are going to push you, that are going to believe in the things that you maybe don't believe in yourself. But another thing that I would want to say to people who are thinking of taking the entrepreneurship leap is that when you do get in it and you are successful, because you will be, if you stick to your calling and you stick to the mission that God's called for you, you're going to grow. And, when passion comes together, the business aspect usually follows, and you do have more decisions to make, and you sometimes have the opportunity to get away from the reason why you started. And so if I was going to give anybody advice on becoming an entrepreneur, it's when you grow, because you will, when you are true to who you are, never forget where you came from and why you started. You're going to have the opportunity. I know that I struggled with as our organization grew. Becoming somebody who is business minded, and you have the pressure of changing the way that you do things. But if you always go back to the basics and you always focus on the values and your core values of why you started, then everything will be fine. A lot of times when you're starting to feel uncomfortable and you're unsure and you're like, this is too much, this is not what I expected, just always remember why you started and go back to where you came from and what you were called to do.
Man, you have me all inspired over here, Summer. I know my audience is. I'm like, come on, let's go get them. I'm excited.
I think it's really hard, we have been very blessed to grow, and we've been able to expand our footing. And with that comes, you have more coworkers that you get to work with. Another thing that I would say is never call the people that choose to do business with you employees or staff members. They are coworkers. They have a choice of where they want to work and where they want to spend their days. And I know for us, going back to previously, the question that you asked was, why did you want to do it? Well, in healthcare, it's a very heavy job. It's heavy emotionally, spiritually, physically. And a lot of corporations, they just tend to pull from those people providing that care. And, when I worked for a large corporation, I just saw that they thought that every nurse and every therapist and home health aide was just a number. Every patient was a number. And when I say that, healthcare is a ministry, and we feel like to work in healthcare, it's a calling, it's very heavy. And so when they pick them off as numbers, or they treated them, like go do another visit or go see another patient, that didn't sit well with me. And so we wanted to do it differently, where we poured into the people that were providing the care, knowing that if we took care of them, they would take care of the patients that we get the opportunity to serve. And so just change your narrative, change your wording. You're gonna, I'll tell you from a young entrepreneur, when you make it and you do well and you start to grow, you're going to have those pressures that every business person has. You may start to get cocky at times. You may have, the struggle of, like, I need to make this decision, or I need to let this person go, or I have to discipline somebody who works with me that's a dear friend of mine. Always remember where you came from. Always remember those people have choices, and they're choosing to help you live out your dream, and how you treat them is going to be extremely important in your success.
That's awesome. So let's switch it up a bit. Let's talk a little bit more about Healing Hands Healthcare. So tell us a little bit more about the company.
So Healing Hands Healthcare is a home health company. We provide skilled care. There's several different types of home health company. There's private duty, and then, there's medical skilled care, and we are on the medical side. So we send nurses, therapists, home health aides into the patient's home. So what that looks like is for patients that are homebound, whether, long-term or short-term. So a lot of people think as home health as, when your grandma can no longer leave the house or she's bedbound, but it's so much broader than that. And especially through the COVID-19 pandemic, I think that, our nation and the world got to see the benefit of home-based care. And so what we get to do is, what I love the part about my job is that we serve the sandwich generation. And so what I'm saying is that, people like you and I who have older parents that also have younger kids, and our lives are very busy. And so sometimes they're torn. They want to give more attention to their parents, and they also have kids that are very demanding, or they're building their career, or their marriage, whatever it may be. And so we get to come alongside of those families, and we get to just join that family, and we get to help take off some of the stress of caring for the aging generation, or somebody who might be in the middle of that, who might have gotten a knee replacement or a hip replacement, and they're short term kind of condensed to their house. And so that's what we do. And it is the best job in the whole world. We come in and we get to talk about, what meds are you on, or what are you struggling with? Our favorite is the patients that, they've struggled with chronic diseases for a long time, and they may bounce back and forth to the hospital, or they may, not understand how to take their meds. And so their quality of life has suffered. And we get to come in alongside of them and educate them and help them be home where they want to be, because they spent their whole life, trying to get to the golden years. And that's really what we want them to be, our golden years. And so we get the opportunity to come in and just help them, reach that goal.
So obviously anything in healthcare, like you mentioned, it's not easy, and it's very high touch, because you're dealing with people that are, many times, in need of care, hence the reason for the calls, right? So it's not always easy. And then you're dealing with different points of view, whether it's the families, the patient, the doctor, the nurse. There's so many moving pieces here, and all of them are related to humans, which is never going to be easy, right? But that being said, like, as you build your company and as you've grown, like, how important has culture and what you do and really contributed to your success?
Oh yeah. Well, I work with the most amazing people. I say every day that I get to come to work with 180 of my very best friends, and I truly mean that. For us, culture is everything. And, I really struggle because we have a 6% turnover rate over 5 years, which is unheard of in any organization, but especially the healthcare industry. And we contribute it to the fact that we always put, our people first. Like we said, you can't pour from an empty cup. And so when we get asked to talk about culture, for me, sometimes it's really hard to talk about it, because it just comes so innate, and that I feel like it should be a part. It's just a natural part of how you treat people, regardless of, what your religion is. Like I said, we're deeply rooted in faith. The golden rule is to treat people as you want to be treated. And I think if you do that first, everything else falls into line. But also, for those of you that read, the book, The Advantage by Patrick Lencioni, he talks about how corporate culture is the advantage that most people don't think of. And so, I talked about earlier, as you start a business and you have the opportunity to, get pulled in different directions, never forget that the best secret that you have in your pocket is how you treat your people and how they feel about serving for you.
No, that's amazing. And I get that. And that 6% turnover rate, you have a big staff. That's amazing. Like, that is so low. To have that number attributed to the culture. It's one thing to say it. It's another thing to have the numbers back it up too. It's amazing what you're doing over there.
Thank you.
I want to go more into the actual, services and kind of the day-to-day of what Healing Hands Healthcare look like. So you said, home-based medical care. Tell us a little bit more about what that looks like.
Okay. Well, one of the best examples I can give you is through the COVID-19 pandemic, we have what's called a hospital at home program. And so a lot of people don't know what home health is, or, home health also is an industry that can be overrun with fraud. And so some people have, a bad taste in their mouth about it. But through COVID-19 with our hospital at home program, what we were able to do is when the hospitals are full, we're able to provide hospital level care at home. Wow. And so we send nurses into the patient's homes. They can go in several times a day and make rounds just as if they were in a facility. They can give meds, set up meds. They can help them walk through, breathing exercises, especially with COVID and how it attacked the respiratory system. We monitor vital signs, and we also monitor labs. And so for somebody who might have congestive heart failure and they have trouble breathing and their fluid gets out of control, we have nurses that go in and they monitor their labs to see how much fluid they're retaining or how much they're not. And we work with their physicians to adjust their medication. We're basically the doctor's office coming to you. And then we also have therapy. So like I said, people who have had knee replacements and, they want to go home. They've been in a hospital for a couple of days. They want to go home and get strong enough to where they can go to outpatient therapy. They may not need to be home indefinitely, but for those next couple of weeks, it's going to be, the pain's going to be there, that kind of stuff. And so we want to make sure that we come in and we help get them stronger and get that movement back in that joint and help them be able to get back out into the world where they want to be.
So, obviously you started with this business and then you expanded to Little Black Bags house calls. So what was the idea for this, and really how did this come? As if you didn't already have your hands full, so to speak.
I think any business is born from a frustration, like I said, of wanting to do it better. And so for Healing Hands, one of our main goals and what we are held accountable for is keeping people out of the hospital. And so like I said, we have to get orders from physicians, and all of the physicians' orders drive our care. We can't do anything that we don't have an order for.
Yeah.
And so when we had patients, we're treating very sick patients and chronic diseases, and things would come up. So for people who aren't in the healthcare industry, one of the major diagnoses that we treat in home health is, for those of you that aren't in the medical field, is COPD, which stands for chronic obstructive pulmonary disease. And that's a breathing issue. And for those patients that may have smoked all their life or have been around it or just had something happen that caused it, they're very fragile. And so when they get sick, they get a respiratory infection, let's say, bronchitis and the seasonal changes, they can end up very sick very quickly. And one of our jobs is to make sure that we catch those things prematurely so they don't escalate. So when that happens in home health, we are supposed to, call the doctor and tell them, we think this person's starting to get sick. We're seeing early signs of an infection. Well, unfortunately, in healthcare these days, the doctors are extremely busy and they have to run, several patients in and out that day, and they don't always have the time to dedicate to that specific patient that's not in front of them. And so we were getting, always the runaround about, well, just send them to the ER. And we're like, no, that's not what we're here for. We're going to keep them out of the ER. It's simple, and we would report it or not hear back. And so that kept happening. And that's how Little Black Bag was born. I knew that these homebound patients, again, going back to the sandwich generation, every time that they need to go to the doctor, their kids have to take off work and take them, or maybe they have a wheelchair or a walker and it's not easy, or they can't drive, or they might have to ride a city bus because they don't live in they don't have those resources. And so Little Black Bag was born from that. We saw a need that wasn't being met. We needed to fill it. We had no idea what we were doing when we started it. It was a rough couple of years, I'll be very honest. But now we have the opportunity to bring the walk-in clinic to them. So to keep them from going to the ER, to keep their kids from having to take off work, we don't take the place of their primary care doctor. We are sometimes the primary care physician or provider for our homebound patients that truly can't get out, but we work with and collaborate with them. So just like you or I, if we were sick, could go to a walk-in clinic, we bring the walk-in clinic to the homebound population. And also for Little Black Bag, not just the homebound population, there's a convenience factor there for people like you or I who are working and, may not have the time to go sit in a waiting room for 3 hours. And so what Little Black Bag does is it treats the homebound population, but it also is the walk-in clinic that comes to you, whereas your office, your home, we like to use the term that your living room is your waiting room. So you just call and set up an appointment and you have the rest of your day to do what you want, but you know that we'll be there on time at that appointment to get you the care that you need.
I love that. Your living room is your waiting room. That's so catchy.
Yeah.
So what geographies do you serve? Like what areas are these in? Because I know there's people that are watching. They're like, oh my gosh, like I didn't even know this existed. Like what areas do you serve?
So we are currently in Texas. We are in North Central Texas, and we serve 22 counties in North Texas for Healing Hands. And then we are licensed for the entire state for both organizations, but we still currently are in those 22 counties and expanding hopefully day by day.
That's fantastic. So what's the plans going forward? Like, I mean, the business is growing. Obviously, you're doing great work, have great culture, great retention. People are happy. I mean, what's the plans going forward?
The plans are just to keep taking this into each community. We are really big about serving the communities we're in. We do not outsource anything. We are not a believer in it. We go into the communities and we hire people in those communities and we spend our money in those communities. And so that's really what we want to do is we want to take it nationwide, and we want to do it one community at a time by going in and giving them a place to work that's full of hope, and, just take the healthcare ministry into the other states.
Oh, that's awesome. I mean, that is exciting, Summer. And I love what you're doing. And I think it's great. And I think that really you're putting in the work, you and your team, of course. Nobody does it by themselves. You and your team are doing, and your approach of taking it community by community and not getting like overly like, we have to expand immediately. We have to do this. We have to do that. And like really taking a methodical approach to build something that matters and that will last and that will continue to serve those communities. I think it's great what you're doing.
Thank you. It's very rewarding. There are stressful days, but like I said, I have the most amazing teammates, and my business partner, like I said, she's amazing, very blessed, and I think I have the best life.
So Summer, if somebody is watching this and they want to learn more about Healing Hands Healthcare or Little Black Bag House Calls, or just follow your work and just to continue to cheer you on, I mean, what's the best way for people to do that?
I'm on LinkedIn. We have social media. We have Facebook for both of them, Instagram, LinkedIn, Twitter. Obviously, we have our websites, which is for Healing Hands, www.hhcwf.com, and for Little Black Bag, it's www.lbbhc.com.
Fantastic. Well, Summer, really appreciate you coming on the show today and sharing more about your background and your entrepreneurial journey, of course, but also, I mean, the amazing work you're doing over at Healing Hands Healthcare and also Little Black Bag House Calls. So great stuff there. And to the audience, as always, thank you for tuning in. Hope you got a lot of value out of this. Hope you learned a lot. If you did, don't forget, hit that subscribe button. We want you to be a return viewer or listener, depending on where you're consuming this at. And Summer, thanks again for coming on the show. It's been awesome.
Thank you, Adam. Have a great day.